Are you ready to become a licensed nurse and ace your NCLEX on your very first attempt? Don't worry. I'm here to guide you every step of the way. In this video, we will be talking about different strategies to crack the NCLEX exam. We will also be practicing with different types of questions, including multiple options, and select all that applies type of questions, and also case study questions. I will show you the right answer and also explain what strategies we use to eliminate the wrong answer. So, in all, today's video is going to be very informative. Please stay with me till the end to get fully informed. Here are some key strategies explained with examples in this video. 1. Focus on patient safety and prioritization. The NCLEX prioritizes patient safety above all else. Questions are often designed to test your ability to recognize life-threatening conditions and decide the best course of action. Let's see an example. I will take a very easy question just to let you understand the concept. A patient with a history of asthma is experiencing shortness of breath and wheezing. What should the nurse do first? The options given to you on the screen are: A. Notify the healthcare provider. B. Administer the prescribed albuterol inhaler. C. Obtain an oxygen saturation reading. D. Encourage the patient to lie flat and rest. The correct answer to this question is option number B. Administer the prescribed albuterol inhaler. Here, there is a need of patient safety. Immediate intervention is needed to open the airways. So, why not A? A is incorrect here because we notify the provider only after initial interventions. Why not C? It's because oxygen saturation can be assessed later, action is needed first. And why not D? It's because lying flat could worsen breathing difficulties. Let's see another strategy. Use the process of elimination. The NCLEX often includes distractor options that seem correct at first glance. Eliminate wrong answers by looking for inconsistencies with nursing principles or prioritization frameworks like ABC, airway, breathing, circulation. Let's take an example. A patient is recovering from surgery and reports calf pain. Which action should the nurse take first? The options given to you on the screen are: A. Administer pain medication as prescribed. B. Massage the patient's calf to relieve discomfort. C. Assess the patient's calf for redness, swelling, or warmth. D. Notify the healthcare provider about the patient's pain. The correct answer to this question is option C. Assess the patient's calf for redness, swelling, or warmth. For option A, pain medication doesn't address the root cause. For option B, massaging the calf could dislodge a blood clot. For option D, notify the provider only after gathering necessary assessment data. For option C, this option aligns with the nursing process, assess before acting. Now let's see the third strategy. Learn to read the question carefully. Pay attention to keywords such as first, which indicates the initial action you should take. Best, which suggests more than one option may work, but one is ideal. And most important, which indicates prioritization based on safety, urgency, or effectiveness. Let's take an example. A nurse is caring for a patient with diabetes. The patient reports feeling shaky and lightheaded. What is the nurse's first action? The options given to you on the screen are: A. Administer the prescribed insulin. B. Check the patient's blood glucose level. C. Notify the healthcare provider. D. Offer the patient a glass of orange juice. The correct answer in this case is option B. Check the patient's blood glucose level. Here, the keyword first requires you to assess before intervening. Administering insulin without checking blood sugar could worsen hypoglycemia. The provider should be notified only after assessment. D. Juice can be given after confirming low blood sugar. Practice using the nursing process, ADPIE, and Maslow's hierarchy of needs. Hey, I just wanted to quickly share something with you that I think could make all the difference as you prepare for the NCLEX RN. I know how stressful it can be, especially when you're balancing everything: clinical hours, coursework, life, and trying to carve out time to study. Trust me, I've been there. That's why I highly recommend checking out the 4 weeks to NCLEX RN questions and answers practice guide. It's a taken for preparation of this video. What's awesome about this guide is how it's designed specifically for busy students like you. It breaks everything down into manageable weekly goals, so you're not overwhelmed and you know exactly what to focus on each week. The structure is simple but really effective. Week 1 sets you up with foundational strategies and helps you get comfortable with the question formats. Week 2 digs into the core nursing concepts, things like patient safety, prioritization, and critical care. Week 3 covers pharmacology and body systems, which we all know can feel like a huge challenge. Then, Week 4 is all about practice realistic exam simulations and reviews that really help you gauge where you stand. What I love most about this guide is that it doesn't just focus on the right answers. It's all about understanding why the correct answers are right and why the others aren't. It really teaches you to think critically, which is such a huge part of the NCLEX. If you're looking for something to help you stay on track without adding more stress, this guide is worth checking out. I really think it could make your prep a lot smoother and, most importantly, help you feel more ready. Good luck. You've got this. The nursing process, assessment, diagnosis, planning, implementation, evaluation, ensures safe and logical decision-making. If you don't know about this topic, I have included a separate video on ADPIE in the description. A patient with hypertension is prescribed a new antihypertensive medication. The nurse notices the patient's blood pressure is 88/56 before administration. What should the nurse do next? A. Administer the medication as prescribed. B. Reassess the patient's blood pressure in 30 minutes. C. Notify the healthcare provider about the low blood pressure. D. Hold the medication and document the finding. Here, the correct answer is option D, hold the medication and document the finding. So, if we use the ADPIE strategy in this question, the assessment is the low BP reading was already assessed. The diagnosis, risk for hypotension. Planning, ensure patient safety by avoiding further BP reduction. Implementation, hold the medication. Evaluation, follow up later to ensure BP stabilizes. Let's see another example showing Maslow's hierarchy of needs and also the ABC principle. Which patient should the nurse assess first? A. A patient with a headache after a lumbar puncture. B. A patient reporting chest pain and shortness of breath. C. A patient with nausea and vomiting for the past 24 hours. D. A patient with a reddened area on the sacrum. The correct answer in this question is option B, a patient reporting chest pain and shortness of breath. For Maslow's hierarchy, prioritize physiological needs first, airway, breathing, circulation. Chest pain and shortness of breath indicate a possible cardiac or respiratory emergency. Why not A? Headache after a lumbar puncture is common but not life-threatening. Why not C? Nausea and vomiting can wait unless dehydration is severe. Why not D? Skin integrity issues are important but lower in priority compared to ABCs. Understand the NCLEX format. Let's start with the most common type, multiple choice. These questions test your ability to prioritize and make safe nursing decisions. Let's take an example. A patient receiving digoxin reports nausea and dizziness. What is the nurse's priority action? The options given to you on the screen are A. Administer an anti-nausea medication. B. Assess the patient's potassium level. C. Notify the healthcare provider immediately. D. Reassess the patient in 30 minutes. Correct answer, B. Assess the patient's potassium level. This follows the nursing process, ADPIE. Always assess before taking action. Nausea and dizziness are early signs of digoxin toxicity, often related to low potassium, so you always have to assess the patient's potassium level. Next up, select all that applies questions. These can be tricky, but remember, each option is either true or false, so evaluate them individually. The nurse is educating a patient about taking warfarin. Which statements indicate the patient understands the teaching? Select all that apply. The options given to you on the screen are A. I should eat more green leafy vegetables. B. I will have regular blood tests to monitor my INR. C. I should use a soft bristle toothbrush. D. I can take aspirin for headaches. E. I will report any unusual bleeding or bruising. There are 3 correct answers here, B, C, and E. B is correct. INR monitoring ensures therapeutic levels. C is correct. A soft bristle toothbrush reduces bleeding risk. E is correct. Reporting bleeding is critical for anticoagulant safety. A is incorrect. Green leafy vegetables are high in vitamin K, which can counteract warfarin. D is incorrect. Aspirin increases bleeding risk and should be avoided. Next is for priority questions. Priority questions ask you to decide what's most important. We have already discussed how to deal with Maslow hierarchy of needs and ABC type prioritization. The new NCLEX format also includes case studies where you analyze multiple pieces of information and make decisions. Here are my final tips to pass the NCLEX on your first attempt. 1. Stick to a study plan. Dedicate time each day to review high-yield topics. 2. Use NCLEX question banks to practice daily and improve your test-taking skills. 3. Focus on understanding concepts, not memorization. 4. Stay calm during the exam. Remember, each question builds on the next. You've got this. Believe in yourself, and with consistent practice and the right strategies, you'll be celebrating your success as a licensed nurse in no time.